Good evening, everybody. Welcome to the Research Triangle Professionals COVID-19 Public Health Presentation and Panel Discussion. We are glad to have you with us tonight. We have public health professionals here with us. We're excited to have them to help us follow up on the conversation that we had earlier this year. And so much has changed since we talked about the pandemic that has been with us since I would say February, March timeframe. So here is the schedule for tonight. First of all, welcome. Also, if you have any questions, if you have any technical difficulties, please put your questions in the chat. Please be mindful that we are recording tonight. We're also live on Facebook. So if you have colleagues or friends who want to watch us on Facebook Live, they can go to our Facebook page, and I'll ask Doug if he can put that in the chat for people. The agenda for tonight, we'll do introductions. We have several objectives we want to focus on. We want to get an update on where our state is and kind of the current situation with COVID-19 and how it's affecting our community. We also want everyone to get some valuable knowledge on how you can continue to protect yourself, especially with the holidays coming up. Understand how the COVID-19 virus spreads. I think just having more understanding will help you better protect yourself and your family. And also, we want you to integrate best practices to prevent further spread and to allow you to incorporate what you learned tonight into your daily living. What we always do as a NSBE organization is, if we were in person, we would stand and we would repeat the mission. We would ask our guests to do it as well, but since we are virtual, I'll just repeat it for you tonight. And it is the NSBE mission is to increase the number of culturally responsible Black engineers who excel academically, succeed professionally, and positively impact the community. And what we're doing tonight is focusing on being culturally responsible. If you are new to NSBE, this is just a brief understanding of how we came. It was founded in 1975 at Purdue University by 6 college students who were from Chicago, and they wanted to understand the disparities in education as Black freshmen. They recognized that the dropout rate was 80% at their university, and after a while, they recognized that this was common at other predominantly white institutions at the time. These students came together over a period of time, established a conference, and fast forward, they were able to eventually organize what's now known as the National Society of Black Engineers. And they developed a mission. Shortly, I would say about 10 years after that, the professional chapters were developed, and then NSBE junior chapters were developed. And our discussion tonight, as I mentioned earlier, a part of our mission is to be culturally responsible and positively impact the community. And what we're doing tonight is focusing on our TORCH initiative, and TORCH stands for Technical Outreach Community Health. And what we're providing tonight is information that is going to help the community and allow us to serve you with this information and protect ourselves and improve our public health. So we have other initiatives and activities that'll be similar to this, but for now we want to focus on what we can do to better protect ourselves. To kind of kick this off, I want to just kind of survey the audience, and in the chat, if you don't mind, let us know who is joining us tonight virtually. Do we have students? If so, what school do you attend? Do we have people who are joining from other organizations in the community? Did we have just, people who heard about this, saw it on Eventbrite or on Facebook and decided to come out? Tell us who you are and why you decided to join. We would just like to have that information so that we can engage with you throughout the evening. And I did not introduce myself. My name is Tony Arnold McFarland. I'm the president of the Research Triangle Professionals chapter that serves Raleigh, Durham, and Chapel Hill. Tonight, I am going to turn things over to our public health liaison, Kirsten Ingraham. She is going to introduce the panel. She's going to kick off things from this point. She and I are going to we'll kind of tag team tonight on the rest of the program. And again, welcome to our discussion tonight. Kirsten, would you like to introduce yourself?
Thank you so much, Tony, for the introduction as well as the platform to be able to talk about such a key and pivotal public health emergency that is before us right now. Hi, everyone. Thank you all for taking time out of your evening for joining us as well. We look forward to the discussion as a follow-up to a discussion that we had earlier this year in regards to COVID-19. So many things have changed since then. There have been so many discoveries, and we're on the cusp of realizing some new advancements in regards to COVID-19. So please join me in providing a warm welcome and sign of applause for our panelists that we have. Before I go into introducing our panelists at the moment, I'm going to give you just a quick brief synopsis in regards to COVID-19. At the end of the day, coronavirus 19, it is an infectious disease, and it's caused by what is considered a newly discovered coronavirus. The best way to prevent and slow down transmission is to be well informed about COVID-19, as well as knowing for the disease, how it spreads and what causes it. So we're going to go over some of those pieces today during our panel discussion. We're going to talk about ways in which you should protect yourself to keep you safe, as well as to keep others safe from infection, as well as we're going to go and have some Q&A and have some fun times. So while this is a very serious matter that we're chatting about right now, we hope that you are able to take this information, share it with your family, friends, and loved ones, and we look forward to beginning the presentation with our panelists. Thank you. Our very first presenter is Benjamin Money, Deputy Secretary with the North Carolina Department of Health and Human Services. Mr. Money is going to be speaking to us about the current state of COVID-19 in the state of North Carolina, where we are with advances regarding COVID-19, as well as the rollout of some different advances that we have that are on the cusp of coming to fruition. Without further ado, Mr. Money.
Yes, thank you so much. I really appreciate the opportunity, Kirsten. I'm going to share my screen if I can. Let's see. Can you all see my screen right now?
Not yet. I'm going to stop sharing. Okay, try that again, Mr. Money. Now we can see it.
You can see it now?
Yes.
Okay. Okay, very good. Let me get to slideshow view. Okay, thank you again for the opportunity to present to you this evening. I wanted to give you greetings from the North Carolina Department of Health and Human Services. As you know, we're very active in the COVID response in North Carolina. We're seeing our numbers climb. I wanted to give you some updates on that, give you an opportunity to really consider your holiday plans and really the implications for that. I know we've got a big and packed agenda for this evening. I've got a few slides that I will clip through, but this deck will be available to you. So just know that if I fly through, those resources will be at your disposal. So, let's see. Okay. So if you go to our dashboard at the North Carolina Department of Health and Human Services, you can see a daily count for our key metrics. And these key metrics are what really drive our response in North Carolina. You know, we obviously look at the total number of cases that have accumulated since the start of the pandemic. And right now it's over 320,000. We also have had just in the last day, 3,367 newly reported cases. And then, unfortunately, 1,537 individuals that are currently in a hospital. And throughout the course of the pandemic, a very unfortunate 4,898 deaths. And, you know, at the rate that we're going in terms of deaths, you know, we're going to be clipping the 5,000 mark, unfortunately, very shortly. And right now we're at the 9.2% positivity rate, and that's in terms of tests that have been conducted. That's for yesterday. It varies, but on average, we've been somewhere north of 7.5% for several days now, and that gives us great concern. So if we look at our daily case rate, you can see that case rate from March, when we really were beginning to start monitoring the pandemic, as we were seeing it move across the United States. And then to the point where we are now, you can see that we've actually had two peaks. We had a peak in the summer, and then we're on a upward trajectory now. And it was pretty anticipated that we would go into the fall with higher case rates, simply because we're going into cold and flu season. But a lot of that is really driven by the fact that we're indoors, people are closer together, and air, will recirculate. So we know that cold and flu season drives up our case rates for respiratory viruses, and the coronavirus is just that, a respiratory virus. So that's our cases. And if we look at deaths, one of the things that we can see is that, over time, our death rate has somewhat fluctuated. But given the fact that we have a higher and increasing case rate, our deaths have thus far remained somewhat stable. And a lot of that has to do with the fact that over time, particularly during the spring, our hospitals are really preparing for how to manage COVID cases. And right now, we also have new treatments that are available for COVID, but it's still a very deadly virus. We're seeing deaths across the country increase. And quite honestly, if we don't take drastic measures now, then after the holidays, we could see an even greater spike in hospitalizations and deaths. So one of the things that we did in North Carolina was really early on recognize the fact that around the world and across the country, people that were historically marginalized, folks that whatever country you're in, and in the United States, it would be African-American individuals and individuals of Hispanic, Latinx origin, or Native Americans, people whose in society have been economically and socially disadvantaged, have fared worse in terms of the virus. And a lot of it has to do with roles in society in terms of their need as employees to be encountering new and different people on a daily basis. We use this term essential workers. I don't think that term was really in vogue prior to COVID, but when COVID hit, essential workers was really a key term. These are the folks that are in your grocery stores, your gas station attendants, people that work in hospitals, caring for patients, people that work in sanitation, people that work in meat processing plants or agriculture settings, and particularly those individuals that are in frontline, low-wage positions are more likely to not only have increased risk of exposure to COVID if they are encountering people, but also come into these positions with increased health disparities, and I'll talk a little bit about that later. And one of the great disparities that happened early on in the pandemic, when our governments restricted movement and created areas and times when we were closing down places, we found that folks that worked and had opportunities to work remotely were disproportionately not people of color. So people of color had less opportunities to telework, which means, again, they had more exposure to COVID in their occupational settings. And those health conditions that historically marginalized populations face, that put them at severe risk for COVID include, many of the conditions that we were battling prior to the pandemic. Heart conditions, sickle cell disease, type 2 diabetes, hypertension, asthma. Those are conditions that also can lead an individual to having a poor outcome and poor case of COVID-19. So when we look at, and this deck is actually, I've got stuff that's in front of it and I can't see, I'm sorry. This is actually, thank you, this is the demographic data for deaths. And this represents the most recent profile for North Carolina. We see that by race, we have deaths that 29% of African American population is represented in the total death count. And proportion of the population, we're at 21%, so overrepresented in terms of deaths. And the American Indian population is around 1.3%, so trending right at around their population percentage, and Hispanic Latinx population at 9%, and again at that population percentage as well. So you can see African Americans overrepresented in terms of deaths. And in terms of cases, what we've seen since March is really a trending towards a higher percentage of African Americans and Hispanic Latinx persons early on and towards the summer in the pandemic being disproportionately impacted. And over time, that's created a leveling off, and we're seeing that leveling off even though the pandemic is increasing. So a greater attention to messaging, greater attention to providing access to testing resources in their communities. The other thing we see about cases and in terms of the Hispanic ethnicity is that 28% of the cases are Hispanic, so a greater number of cases to the population, but a smaller percentage of the deaths. And a lot of that has to do with the occupational settings in which individuals work, and also close quarters in terms of their living situations, more congregate settings, larger households. The other thing that we're seeing in terms of cases, and this is really by age, is early on in the pandemic, we saw older people being more affected, particularly people that were living in long-term care settings, nursing homes, adult care homes. And what we're seeing now is a greater percentage of people that are younger, right around that period of time when college students were going back to school for the fall semester. We saw increases in COVID cases among the 18 to 24-year-olds. And what we surmised is that when campuses closed to in-person learning, sent students home, those students went home and infected their family members. And so we saw a rise in older cases. And then right now, it's very much a rise in some of the younger to middle-aged cases across North Carolina. This shows you the impact in terms of hospitalizations, and this goes back to when we were getting consistent demographic hospitalizations information from the CDC reports that the hospitals had to send in, so kind of early to mid-October. And what we see is really some fluctuation in terms of the percentage of people, number of people, I should say, that are from the various demographic groups that are hospitalized across our state. And these are individuals that are confirmed COVID cases and are hospitalized as a result of that. What we also see in terms of the daily trends is, again, with the ethnicity of Hispanic population, a smaller number of Hispanic individuals that are hospitalized compared to the rest of the population. Okay. This is a breakdown of the newly admitted COVID patients. And again, one of the things that we can see is that the African-American population is trending higher versus their normative population, as well as the Native American population, so higher than their percentage represented in the overall population of the state. The Hispanic population actually is a bit less in terms of hospitalizations. And some of that tends to be because the cases of the Hispanic population tend to be younger, again, similar to the reflection on deaths. So one of the things that we've done just recently, just this week, is introduce the county alert system to help communities, help residents of areas identify where there is significant spread within their geographic area. We've done it by county. So it's really a red, orange, and yellow system across the state. That is published on our DHHS website. We're looking primarily at a period of time, in this case it's 14 days, where you can see just where there are significant hotspots. And this data actually reflects not only cases, but also impact to hospitals. Those are really some of the key metrics that we utilize to determine which areas, which counties within North Carolina are of significant concern. And we utilize a lot of the federal reporting parameters as well to help us draw those inferences. So in terms of North Carolina's response to COVID-19, we really focused on 4 key pillars. First one is really around prevention. And you've probably heard about the 3 W's. You've heard about, which is, wearing a face covering, waiting 6 feet apart or more, and washing the hands. We also have been really working with our state and county leaders on enforcement and making sure that we have enforcement measures in place for businesses, for venues, social gatherings, to make sure that folks are abiding by the executive orders that the governor's put in place. The other thing we've done is we really ramped up our testing to assure that we've got sufficient testing across the state. Right now, in terms of our overall testing, we're at about 35 to 40,000 tests on average a day across the state, and we've developed resources that are on our website to help you identify where you can get a test. And we've also made sure that we've hosted testing locations for communities that didn't have access, communities are disproportionately represented in COVID cases, so our historically marginalized populations, as well as making sure that there's testing available for anyone regardless of their ability to pay. So we got a lot of free testing sites available. And right now we really want people to get tested. So if you don't have to be symptomatic, you don't even have to have identified exposure to a COVID patient. Essentially what we're saying now, given the fact that we're moving into the holidays, it's a very critical period, we want everyone to get tested. And we also want to make sure that if you are tested and you tested positive, that you pick up the phone if someone from the health department contacts you. Our contact tracing is a very active feature of our local health departments. We've got teams of folks that are really working to not only assist people that have been tested positive, but also identify folks that they've been in contact with so they can get tested, and if necessary to isolate and quarantine. So quarantine if you're suspected of COVID, isolation if you do have COVID. We've also been putting support programs and services together in about 53 counties to assist individuals that may not have the financial resources to be able to spend 10 to 14 days in a quarantine or isolation setting because they need to work and they need to put food on the table. So helping them with food and financial resources as well. Again, focusing a lot of our attention on our historically marginalized populations. I talked a bit about some of our prevention issues that we had early on, particularly around misinformation and mistrust, and some of the strategies that we developed. And again, I'll leave these to your perusal later on. We talked about the guidance and executive orders that the governor and our team have put together to really try to mitigate the spread of the pandemic. And just recently, the governor modified phase 3 to essentially limit mass gatherings indoors to 10, and really looking at further measures that need to be taken as we continue to accelerate in our pandemic. We also, as I said before, been focusing on assuring that there's testing in historically marginalized populations and making sure that we've got testing available in various modalities. So, you know, there's a PCR test, and then there's the test that's the antigen test that's available. And now we're starting to measure both of those. And you can see where we've got testing available. And then this actually represents the percent positives. So 7.9% of our tests that have been coming back positive. And again, that does fluctuate, but we are seeing it going up. And then when we look at our county maps to determine where positivity is, and we're seeing some of those very same areas. And again, this is where testing positive occurrences are in place. We've also been really working on strategies to improve our contact tracing and coordination with that, and ensuring that we have people that represent Black, Hispanic, Native Americans that are working on our contact tracing team. We also developed a slow COVID app that you can put on your phone. It's a contact notification application. So if you've been in contact with someone else that has that app and they have COVID, it will notify you so you can get tested. I talked a bit about our isolation and quarantine supports, and right now that program is paused until our vendors can catch up with the backlog of referrals that have been made to them. We've had overwhelming support for that program. One of our challenges right now is that we're working off CARES dollars, which is federal funding that ends at the end of December. We've got to expend all those funds or they go away, and we haven't gotten any assurance of CARES dollars coming from Congress. So we're sailing a bit into the fog. We do believe the new administration is going to be working with Congress to get that out, but we're really afraid of a lag time there. We know that behavioral health is going to be an issue for us, so focusing a lot on that now and when we're in the pandemic. Procurement is a big issue for us because we want to work with more community-based organizations, but working with state government and contracting is somewhat of a challenge. Vaccines, I know we're going to talk a bit about vaccines later on, but it's important to know that that really is a light at the end of the tunnel for us right now. You're probably following in the news where Pfizer and Moderna are in their phase 3 of the vaccine trials and getting really good results from that thus far. And so we're actually anticipating having vaccines available to us perhaps by the end of the calendar year, but certainly in first quarter of 2021. Been working with the North Carolina Institutes of Medicine on a process of vaccine allocation and distribution. We want to make sure it's transparent, that we're utilizing data to make the decisions, and that we've got appropriate stewardship for the process. And people have been very concerned about this vaccine, the development of it, and know that the process for the COVID vaccine development is following the same protocol as regular vaccine development. It's under the term Operation Warp Speed, but that does not mean it's skipping steps or cutting corners, that there's a very rigorous process in place, and many eyes are scrutinizing the process to assure that there is safety and efficacy of the vaccine. As well as, I think the thing that really does speed the process up is that manufacturing is happening in a parallel fashion as vaccine trials and the approval process. So there will be an emergency utilization authorization for the Pfizer and the Moderna vaccines, and we should see those out shortly. There's also additional vaccines that are in the pipeline. And so really good news and hopeful news in that front. We put our plan in October 16th. There are prioritized groups that have been recommended by the Institute of Medicine. We definitely want to make sure that healthcare workers get vaccinated first. One of the things we're seeing in other parts of the country is healthcare workers, because of their exposure, are becoming sick, contracting COVID. That's depleting the workforce. And as we increase cases and we have more people in the hospital, it's going to be important that our healthcare workforce is available to be able to care for them, or else we're going to have more deaths. And then long-term care residents, adults with 2 or more chronic conditions, and also prioritizing people that are in those high-risk essential work positions to make sure that they get the vaccine as well. But we've got to make sure that people have trust, that they understand the benefits and the risk of the vaccines so they can make informed decisions. We've been putting a lot of emphasis on working with our community partners to engage and understanding what are the barriers and really trying to work to overcome them. I'm not going to talk about holiday safety during the pandemic because one of our next speakers will be, but suffice it to say, we are very concerned about the holidays. We want to make sure that if you do elect to gather, we recommend that you don't. We recommend that you stay in your household. Notice I didn't say family, but your household, people that you have lived with for 2 weeks or more. But if you do elect to gather, we want to make sure that you do it as safely as possible, preferably outdoors, and in smaller gatherings as much as possible with proper social distancing and hygienic practices. Same thing holds true if you're thinking about Black Friday shopping. Anytime you gather in a large crowd, you run the risk of contracting COVID. And so really want to make sure that people think about this, shop online if possible, begin shopping earlier, don't get in these crowded situations that are typical Black Friday. And obviously, if you've got COVID or suspect you do, don't get out in public. There are a lot of things that are happening this year. I know stores have gone early. There's more delivery options, curbside pickup. And if you do go out, obviously, wear that mask, practice social distancing, and don't go to stores that quite honestly don't adhere to those practices as well. Make sure you've got hand sanitizer with you and that you're being very mindful of what you're doing and where you are whenever you're in the store. I go in like a surgeon. I have a list and I get it done. So be careful where you shop. Know your 3 W's, and thank you so much for the opportunity to present. I look forward to the conversation later on in our discussion.
That was excellent. Thank you so much, Deputy Secretary Money, for that. What key pieces we need in terms of going into the stores, knowing what you need, having the proper protective equipment on as you go in, how to safely be with your family and your loved ones and what that time frame looks like, as well as sharing with us the dashboard of where we are with the number of testings that have been completed in the state, as well as the number of positives that we've had. Unfortunately, those that have passed away from COVID-19, and really where we are right now in this moment. So thank you again for sharing that information. And Tony, if we can advance to the next one.
Okay.
Thank you.
Get back in here and share. All right, next up, I'll let you take it over, Kirsten.
Thank you, Tony. Next up, we have Ms. Marissa Mortaboy, who is the Interim Population Health Division Director with the Partnership for Healthy, as well as the Partnership for Healthy Durham Coordinator with the Durham County Department of Public Health. She will be talking about where we are in Durham County in regards to COVID-19 and sharing some of the features in regards to the COVID-19 dashboard that is available for public use through the health department. So without further ado, Marissa, if you could share your screen.
All right, there we go. Thank you, Kristen, for the introduction, for the invitation to share about our Durham County coronavirus data hub, and it was great information from Deputy Money. And I do want to echo one thing that he said, is that when the local health department calls for contact tracing, to please pick up, because that helps us fight the virus. It helps us keep it in control, but we can't do that unless we find out who else has been exposed. And just as well, it helps us to get information from people who are positive cases as well. And so stating that this is our data hub. So we've had this for several months now. Once we hit 500 cases, we had people from the community and our partners asking us about cases, but because we were below that 500 case threshold, we didn't want to share data. And so as we got closer to that threshold, we were thinking about what are the best ways to share data, what type of information was the community asking for, and how do we present that in a way that's understandable. And so so this is the address, and I could drop it in the chat as well when I'm done speaking, but an easy way to get to this is go to the Durham County Department of Public Health website, which is decopublichealth.org, and our banner is COVID. That's what most people are looking for. And so if you click on it, you can get to the dashboard. And so this is a partnership between the health department. We're also working with a data scientist within Durham County as well. And so this is definitely a group effort. So I just want to walk through some of the features that we have. And so if you look for information and a couple of new things that we just added this week. So in Durham County, we're up to 10,569 cases, and information on this dashboard is updated on a nightly basis as well. And so I'm just gonna click through to show you some of the features that we have. There we go. And so we have a running total since the beginning of the pandemic in March. And so you could see our running case total, how many cases we have each day. We have total and a 7-day moving average. And so that's the previous 7 days, about what's the average of cases that we've had. And so you can see it increasing as well. And then this is our 7-day moving average. So you can see that they're both continue to increase. And this is what we added this month. It was working earlier. It doesn't seem to be now, but it is a chart that shows by month the cases and their increase and decreases. So March, April, May, and June into July, we saw increases. And then later in the summer, August and September, we saw decreases in cases. And then we saw large increases in October, and we're seeing increases in November as well, which follows the trajectory of the data that you see here for cases. And something else that we've done as well, and so we have weekly data reflections. And so this is to put context to the data. And so this is updated on a weekly basis. And so this is from the 9th, we have the total of cases that we have, the moving average that I mentioned, what things look like in the current month. And so you can see this, which was just was on the data hub. And then we also have metrics compared from the state. The cases are increasing on what it looks like in Durham County as well. And Deputy Money talked about this, who is able to work from home. So we always feel that it's important to provide context to data, not just put data about disparities out there, but why is that? And so also who's at greater risk, who's at lower risk, who is a medical home or primary care provider, where are testing sites located? And when we first started putting these weekly reflections together, testing wasn't as available as it is now. And so not everyone had equal access to testing, and other factors too, what jobs allow employees to work from home or to stay home from when they're sick, or offer paid sick leave, or offer protection like PPE for employees as well. And so just keeping those things in mind. And we also, as the month goes on, we also have data on cases as well by race and ethnicity. And so was that we saw, as Deputy Money said, which was a trend in North Carolina, that Hispanic cases, it was at one point about 2/3 of cases were in the Hispanic or Latinx community, and that's gone down due to efforts in communication and really concentrated targeting of populations as well. And Black African American individuals are underrepresented. So about 37% of Durham County residents overall, but about 30% of cases in November, and white individuals are underrepresented as well. And we also have, so this is data by ethnicity and by race charts. And then we also have a lot of workforce data as well. So I'm not going to go into too much detail, but we have it by industry. And so you can see we're industry have the most cases, and then racial and ethnic breakdown for employment, and also gender breakdown as well. We report out on the percentage or positive rate. And so this is for the first week of November. Just looked at for the last week, for this last week ending on the 16th, and it was 6.6%. And so our positive rate is starting to increase as well. And then we also have the metric and how it compares to the state. So we list testing sites on this as well, and zip code maps. And so our zip code with the highest rate of cases is the 27704, which includes East Durham. And we also have age data, and so it's we get a lot of questions about children and how they are impacted. And so you can see the total percentage here of children who test positive. And we've also added this as well. So this is a chart of active cases, and the marks here are for holidays. And so this first one is Memorial Day, and then 4th of July, Labor Day, and going into Halloween as well. So you can see pretty much after each holiday that there is an increase in cases. And so we expect to see that again with Thanksgiving. Hopefully people will take the advice on how to have safe Thanksgiving celebrations. I know we're going to hear more about that in another presentation, but if people don't adhere to those precautions, we will most likely see an increase in cases as well. So I'm going to go back and to the main page, and one thing that our partners told us as well is that the weekly infographic and these charts are great. There's a lot of data, but it's also complicated. And so what we started doing late in the spring, early in the summer, is doing a weekly infographic to go along with the reflection. And so this just breaks the data down. And so this is the total number of cases, and you can see the trajectory and how many new cases up to that point. And then this is our positive rate. And then we also have race breakdown, ethnicity as well. And this is the age that was in the chart. And also the workplace data that mirrored what you saw in the reflection. But it's in a way for different audiences, because data can be complex. So to make sure that as many people as possible can interpret the data, understand the data, and what it means. And so some other features that I'd like to go through, and I think I still have a few more minutes. Am I okay on time, Kirsten? All right, so the average age is 37 for cases, split about even for male and female. Demographics and occupation, so that's what was on the weekly reflection. Outbreaks as well. Total deaths are listed, and we have hospitalizations. So this one should be, yep, this one is working. And so this is the hospitalizations in Durham County, and so we also have number of hospitalizations at the top. Last week in comparison to 2 weeks ago, and you can see that that's a 40% increase, so it's at 28. And as you look at the different dates, one thing that our data scientist has added is a breakdown by race as well. So you could look, so this is for August, and then as you go through, you could see that information. And I do also want to say too that our data on race and ethnicity is pretty complete. There's probably between 5 to 7% of data that we're missing for race and ethnicity, because what our case investigators calls, that's one of the things that they ask about, is to confirm that it's in the medical record, but we also ask that question as well. So we have as complete data as possible. I know some of that data is missing from the state website, but ours, we try to collect as much as possible to have a complete picture as possible. And so I went through the data reflections and the infographic, and this kind of mirrors what's on the state website. And this is the electronic test by week and positive rates. And this is for a testing facility, to find one in Durham County. And so this is a map. It shows CVS, Duke, Leaders Lincoln Communities Health Center, our fairly qualified health center, different CVS sites throughout Durham as well. And this, as they get added, more testing sites, and we add them to the map. And then this is what is on the reflection as well. You know, click on different zip codes and see what the rates are for cases in that zip code. And this is a percentage of people staying home. So you can see in March, it was at a high, which was near 50%. And so this is during the stay-at-home order. And then you could see once we enter, once you start moving through the phases, the numbers get lower and lower. And then you could see that over time that the percent of people staying home has decreased. And this is how many people we assume have recovered. There's a certain formula, and so it's based on after so many days that people have recovered as well. And my computer's a little bit slow, and so we've Durham County demographics. And so just to give additional context, some GIS resources, and then social media updates. And so this is from our health department, also from the state and Alert Durham emergency response. And we have resources and information on symptoms and prevention as well. And so there's a lot of information, but we're trying to be responsive to the community with the data that they're asking for as well. And so we continue to make additions and changes, but we just wanted to present this so you know what data is available, and if there's anything else, if I could answer any questions about the data or about the dashboard, or you know, about what we're doing in Durham County to address the COVID pandemic as well. And so that's all I have, Kirsten. So I'm going to stop sharing my screen, and thank you again for the opportunity to present.
Outstanding. Thank you so much for that, Marissa. As they say, a picture is worth 1,000 words, and the infographics that are available, readily available to the public and to the community is really outstanding and so helpful. You have everything that you can think of really available in the dashboard. If you need to find out information in regards to where the testing locations are, where the hotter spots are. Thank you so much for placing the link for the dashboard in the chat. And this will be available as well to others that are looking at this information on Facebook Live. Yeah, I really enjoyed that piece, especially in talking about ways that we can stay safe. And actually, it's one thing to say, stay indoors, and when you see the different bumps with the holidays, it really puts it into perspective that the data is really supporting those notions. So thank you for showing us that information, Marissa. Next up, we have Dr. Marion Thompson. She is a professor emerita of biology from the University of the District of Columbia, as well as adjunct professor in maternal and child health in the School of Global Public Health at UNC Chapel Hill. She will be talking to us about what exactly is a coronavirus. Who knew coronaviruses existed beforehand, right? And so we really want to take this time to thank Dr. Thompson for joining us and for dropping some knowledge and educating us in regards to what a coronavirus is, as well as its role it's played in the virology of the disease itself. So without further ado, Dr. Johnson, if you can take over the screen. You're on mute. Nope, we can't hear you. You're still on mute.
Thank you so much for the invitation. I really appreciate being back again. And as you will see from the last time, we had a presentation that was April 23. Much has happened since then, and I'd like to share that with you. So I will go to the first slide, and which is my title slide. So what I'm going to talk about is COVID-19 update, the molecular biology of infection, treatment, and immunity. And so the overview, and as you know, this is a really short presentation, so I want to give you an overview of what I'm going to talk about. When we discuss the molecular biology, we're really talking about the branch of biology that deals with the nature of biological phenomena at the molecular level. And this may sound very lofty, but in a way it's really simple, because it's so important to know and understand the molecular biology, because the molecular biology relates to the infection, the transmission and treatment, transmission and prevention, treatment, and then vaccination. And of course, the final outcome is eradication. And if you understand the molecular biology of the virus, then you will be able to understand, in particular, when information evolves that says this is an effective treatment, or why is it so important to distance yourself. So something is coming up that somebody wants to be admitted, and it's popping up on my screen. Should I say admit? Does anybody else see that?
Yes, if you could ignore that, and our IT team will admit them.
Yeah, we'll handle it. Thank you.
Okay, very good. So we are all familiar with this structure of the coronavirus. And the coronavirus is a virus of the RNA viral families. Viruses are divided into RNA or DNA viruses. And in the name is RNA. So it's an RNA virus, it's spherical in shape, and it has these structures that protrude like a crown. And as you know, corona means crown. Now, really, SARS is one of the, not the simplest virus, but it's pretty simple as compared to some of the higher DNA viruses. It consists of a nucleocapsid protein, and this nucleocapsid is the RNA encased with the protein, and we call this the nucleocapsid. It's surrounded by an envelope membrane, and of course you can see the spike proteins here. Now, the interesting thing about this virus is that when it enters the cell, it codes for its own polymerase, so it can make more messenger RNA, but it also codes for these spike proteins. And understanding the nature of the spike proteins is very important, because it's the spike protein that elicits the greater immune response, which in turns allows for the development of the vaccine. Now, I'm going back to this slide of 423 in an effort to sort of see how far have we come. This is the same slide that I used back then. And as Kirsten said earlier, it's highly infectious, community spread, respiratory droplets. Now, at the time, there was not a lot said about airborne particles or aerosols. So now we know that that is the case. And we were very early beginning to look at the fact that singing in choirs, and in particular in churches, that this was a source of rapid transmission. Since then, we know that just talking, especially loud talking, And how do we know this? Because we know the molecular biology of the virus, we know how small it is. And since some of the earlier studies, we've been able to use technologies that can actually show that there are these I should say nanoparticles distributed within the atmosphere. And so at the time, there was no scientifically proven treatment. And so now we do have some treatment mechanisms. I'll talk about that later. But the other thing, and actually I proposed this even back then when they were saying that the mask protects others, actually the mask protects you as well. And this was very simple to realize if we thought about it, because why do physicians wear these masks? You know, when they are in touch with the people who are infected with any kind of microorganisms, they wear a mask to protect themselves. So just wanted to show, and then we said several trials were underway. Well, let's look a little bit more closely at the virus. And this is just another cartoon of the virus that you saw before. And it again shows the spike proteins. Now the spike proteins are so important because they bind to the cell. If you think of this as the whole cell, just this little strip here, and they bind on these ACE receptor sites. Now, why is this important? Because as we have seen, knowing the molecular biology of the virus gives us the opportunity to develop a vaccine that will actually target the spike proteins and prevent their entrance into the cell. And on the side, I just have a basic overview of vowel replication. So the virus initially attaches to the cell through those receptor sites. And once the virus enters the cell, or we say penetrates the cell, some use the term adsorption, there is an uncoating of this nucleocapsid so that the RNA separates from the protein and it begins to make more RNA. It also begins to synthesize the polymerase enzyme so that more RNA can be made. And then it's transcribed. If you remember that basic replication with, you have the messenger RNA that transcribes, the messenger RNA translates to a protein. So it produces this nucleocapsid protein. So that's where they tell you this right here. And then there's an assembly, and then the viral particle is released from the cell. So really what this virus does is it really hijacks the cell, and it uses much of the cell's machinery in order to replicate as well as to assemble, because this lipid membrane that you see surrounding the virus is really the host membrane. So when it is released from the cell, it picks up some of the host membrane. The next, The next slide shows you this in more detail. And you can see this, oh boy. So you can see the attachment, the penetration, and here is where I mentioned the uncoating of the virus. The genome replication is the RNA making more of itself, RNA synthesis, and then this RNA is translated into proteins. And primarily this would be the nucleocapsid protein. That protein assembles with the RNA, and then it's released from the cell. So when viruses, oh my gosh, I'm so sorry. I'm gonna have to answer this. I'll call you back. Okay, so then that virus goes to other cells and the virus does the same thing. The importance of knowing the molecular biology of all viruses, as well as bacteria, is because when we began to identify molecules that can inhibit the replication, we look at all of these areas. You know, is it more significant to inhibit RNA synthesis or the protein synthesis? Well, with COVID, we see that it seems to be really useful to really inhibit attachment of the virus to the cell. And that is what most of the vaccines are based on. Now, again, I'm just going back over an April 23rd slide to indicate that's somebody's still trying to get in. These are trying to get all that stuff moved out. Okay. So these were the mechanisms that we had discussed on 423 for possible eradication options. As you know, hydroxychloroquine is absolutely of no value. And those of us in virology, we knew that this was the case because there was no specificity for it. There was nothing that this compound could do to alter the replication of the virus or the absorption of the virus to the cell. The other possibility was convalescence serum. And we're still looking at that, and it has shown some effect, but that effect is short term. So convalescence serum comes from a person who is recovering or has had the virus and they have produced these antibodies. However, and so that's what this really is. A convalescence serum represents the antibodies. However, antibodies are short-lived, and just to bring you more, to familiarize you more with this, for some of you who may not know, when we talk about the fact that a baby benefits from breastfeeding because they can get the antibodies from the mother, however, they don't last long. So this is the same principle here. There was another chemical that was thought to be of some value. It's called interferon. And interferon is produced by cells in a response to a viral infection, but it is non-specific. So, and in some cases, very toxic. So this has not been a focus at all. The drug that we were looking at then, Remdisservier, was really thought to be the drug that would be beneficial in treating COVID-19. And so it did receive FDA approval, and it was shown to have some effectiveness, primarily in shortening the recovery times for some patients. However, they were never able to see whether or not it prevented deaths. In fact, it seemed to, just shorten the times of people who would already recover. But just early this month, there was a New England Journal of Medicine article that actually gave an overview of the effectiveness of Remdisservier, and it said that it was good, but shortly thereafter, there have been some studies to say Remdisservier has no effect whatsoever. So it remains controversial. But the most important thing I think it tells us is that we have to go to a vaccine. We must go to a vaccine. And then they were looking at some other drugs, combination of drugs, and thus far there has been no luck. Now, I just want to remind you, when we talk about possible treatment mechanisms, there's no specificity, except, I must admit, with this coronavirus, where you can inhibit attachment to the cell. Because once the virus gets into the cell, it really uses the host machinery to replicate. And so for the most part, if you try to stop that, you are destroying parts of the host cell. And this is very typical, obviously, of viruses. And if we look at the viruses to date that we know of, there are really no treatments. There's some treatment for, I think, some herpes viruses, but that still just slows down the time to get well. And then there's something that's being used for flu, and it's the same thing. So it doesn't really stop, it just slows it down. So what this means is that we are in really need of this vaccine. Vaccine is the way to go for viral infections. And I think the next slide just really shows you the importance of vaccination, especially as it relates to the flu vaccine. You can see last year there were 22,000 flu cases. And this is really significant for us to look at, because there was a lot of rhetoric about the flu being, about COVID being no worse than the flu, and people died from the flu. So there were 22 deaths, and you know the deaths now from COVID, and it's not even a year, 250,000. So that lets you know how important vaccination is. The other thing is that, and this is a typo right here, but the effectiveness of the most recent COVID vaccine is 95%. And that is really remarkable, because most vaccines don't even reach the 95% level. It's said that the effectiveness of the flu vaccine is 40 to 60%. So this alone gives us a lot of hope in terms of, if this vaccine really works, and it should soon be receiving FDA approval through the emergency use authorization. And if we can get that approval and get that vaccine out there, we will be doing so much better than we did with flu and some of the other many viral diseases. One other thing that I wanted, and I forgot to mention, but the distance rule, you know, the 6 feet distance rule that you should adhere to, that is really based on the 1930s data with measles virus. Today, we have so much advancement in technologies, and there have been a number of studies to show that the aerosols can go as far as 10 feet or more. So what I usually do is, I don't even follow the 6 feet rule if I can. You know, I try to do at least 10. And I know the reason for not really spreading that word is, you know, it goes back to do you cause panic? But, you know, that was the thought very early about COVID, that you didn't want to panic the public. But we see what happened there. So In summary, you know, it's so important to know the molecular biology of the virus because it allows for scientists to develop specific and evidence-based treatment modalities, treatment and prevention modalities. Without a vaccine, we can mechanically reduce spread. However, I must say, from April 23rd, when we talked about this and we talked about how we could reduce spread, we have made little progress in that area. And we have to really look at that and really understand why, as public health providers. You know, we can say that the public just won't listen, but the public received a lot of conflicting information, even from our public health experts. You know, wear a mask, it's not helping you, but it's helping others. And then we had leadership that did not stress the importance of these public health practices. So even though there's little progress there, we have made a rapid development in, well, not so much in developing antivirals as it is with development of the vaccine. And so the vaccine approval and distribution is on the horizon, and we have that to look forward to. So we're just hoping that we can move on with that. And that, I thank you for your time.
Thank you so much for that information, Dr. Johnson Thompson. As I said, every time you come, you always drop knowledge and really enlighten us on things that we do not know on the back end. And it really shows us how exactly this virus operates. You know, it's been quite some time since I took a biology class, and I appreciate having that reminder to see how the virus works, how it replicates, and really how it's functioning within our body. So thank you for explaining that and taking something very complex down to a way where we can understand it. So thank you for that.
My pleasure.
Next up, last but certainly not least, and do we have, if we can switch back over to the main slide deck. Dr. Johnson Thompson, there we go, perfect, thank you. Next up, we have Mrs. Sharon Beard. She is an industrial hygienist and program administrator with the National Institutes of Environmental Health Sciences. She's going to talk about ways that we can stay safe in regards to the pandemic, ways that we can stay safe when we're going out and about in the community, while we're at our workplace. And I am just so excited and thrilled to pass the mic over to her. So without further ado, Mrs. Beard.
Thank you, Kirsten. I'm going to share my screen now.
Yes, you can go ahead and grab the screen sharing. Thank you.
Great. Thank you so much. I wanted to say thank you for allowing the National Institute of Environmental Health Sciences worker training program share some information about primarily what we do to protect workers in the workplace. I shared a little bit about this the last time we met, but I wanted to make sure that everybody had a chance to learn a little bit more about some of the resources that we have, and then also talk about some practicalities of how to stay safe during the holiday season and things like that, and some resources that should be able to help you out in that process. So I'm going to continue on here. As Kirsten said, I'm an industrial hygienist with the worker training program, and we fund organizations to do health and safety training. And so what we've tried to do over the last 8 months or so was to fund organizations to help us to develop health and safety training for those individuals who are in the workplace. So we developed several different types of trainings that focuses on the essential worker and awareness training. And we've got other tools and fact sheets that I have here that really shares a little bit about how we've been able to develop different types of tools and materials to share for everybody so they can see what's going on. I just wanted to share just the basic information, the awareness tool that we have available on our website. I posted the link to all of the tools and resources that we have there, and we encourage you to do it. We have an online training that you can take and just to give you information about just awareness of COVID-19 and its impact in the workplace. But then we also have a specialized training tool that we've developed on essential and returning workers that we're in the process of modifying doing our second installment of that, looking at some of the latest research and tools that we found from health and safety professionals in reference to how they're able to move forward. So we're so delighted to be able to have that. But one of the things that I think is so important is some of these workplace checklists for you to be able to develop an infection or exposure control plan in your workplace, in your business. And so these are key tools. So no matter where you are, no matter where you work, this will help your employer be able to determine what are the tools and resources to keep you safe and while you work. One of the things I wanted to share just from a general perspective in reference to getting access to information, we have worked with one of our grantees, the Center for Construction Research and Training, and they have taken the tools and materials that we have under our awareness training and made it into a mobile app so you can get access to information. And then also the training tools are available there, so you will have this right there in your back pocket if you want to have access to that information. Now, what I wanted to do was to talk about some of the issues that I think are impacting everybody. There's a lot of confusion and misinformation about what to think about COVID-19 and its impact on our communities. And so I want to help you to dispel some of that information, to talk to you from the heart as an industrial hygienist, as a person who works every day to protect folks from occupational and environmental exposure, to say we really do have to take this information seriously so that we can protect ourselves and our family. This is the latest data that we have for COVID-19. And as you can see, a lot of that information was already shared earlier, but in North Carolina, in the last 7 days, we've had over 20,000 cases. Our rate as of today is 9.2. But this is an information on the CDC tracker that really talks about where we are, and you can go to the site and figure out where you are. So if you're considering traveling, you will be able to see some of those places that are in dark blue where we have a high infection rate for COVID-19, and you have to plan accordingly because you will have more opportunities to interact with people because there's so much positivity in those states. What I wanted to first talk to you about was understanding community spread. This is so important. So I wanted to bring you with local resources about what has happened. So one of the stories that I read not too long ago was from Catawba County, that's near the Charlotte area, and just one event for a family gathering of 14 people. And if you look at this slide here, it shows how COVID has spread from person to person in the family to the spouse of an individual, co-worker, across the board. And so this is how we're talking about. And this graphic shows the spread over just a 16-day period of what one family gathering caused over 39 individuals to become positive for COVID-19. So this is serious. And so we really have to make sure that whatever plans we make for the holidays and for the next months before we have this vaccine available and wide distribution, that we have to understand this spreads rapidly, and you don't have to have symptoms in order to spread COVID-19. Here's another example of a wedding that happened in Maine. They only had, the wedding, came out of 30 cases, but out of that, there was one death in the local community. Then over 100 miles away at a long-term care facility from one of those individuals who became COVID positive, it caused 38 cases and 6 deaths at the long-term care facility. Then 200 miles away at a correctional facility, there were 82 cases that resulted of that, and only 0 deaths. But one of the things that we have to talk about: avoid large gatherings, stay at home when you're sick, and then wear your mask and stay at least 6 feet from others. And so it's so important that we understand about how community spread is impacting us. And right now, everywhere in the United States, we have wide community spread. So I wanted to share with you a couple of tools that we just learned about. There's a COVID-19 event risk assessment tool. So my director of our institute at the National Institute of Environmental Health Sciences, Dr. Burchak, shared with us today at an all hands meeting what this new assessment tool that Georgia Tech has developed, and what a gathering of 10 people, the risk for those of us in Durham County, it's 20%. But when you look at it, if you go to 15%, our risk goes up 28%, 25 people, 42. So as you see, the more you interact with folks, it increases your your availability to catch the COVID. So please make sure you're planning accordingly. So I want to go over just the practicality. A lot of this information you can find directly from the CDC website, but if you're hosting a Thanksgiving gathering, what they're really recommending is that you really just have your immediate family. That's what they really say. But if you must, these are the steps that you have to take. And I put this picture here is because if you want to really have something, I would encourage you to have, if you're going to have people over that you don't have in your immediate household, do something outside where you're more than 6 feet away, and maybe just have dessert with them. This is something that's lower risk, but here is some guidance for you to think about. But what I want to really talk about in reference to what you need to do to protect yourselves, and this is something that I tell everybody, you have to implement a safety plan that you share with your entire family and anybody who will listen to you about how to do this and celebrate the household within your community. And you can see one of the pictures here is like having your grandma and grandpa virtually attend with you. That's what they're recommending, and it's something that I certainly recommend from a health and safety perspective to make sure that you're safe. One of the new guidances is to upgrade your cloth mask 2 to 3 ply and use it properly. It's so important that you do that. And so I've given you some guidance in reference to where you can get information about face masks. So I'll go over that a little bit more carefully here. How to wear and why you should wear a mask to protect others, and make sure you're wearing it properly. It makes no use if you're not covering up your nose if you have a face mask on. So you please need to make sure, and one of the most important things that I tell everybody is that when you're putting on and taking off your mask, you need to do it in a certain way. Please do not touch the outside of the mask. Make sure you're storing it properly. Make sure that you're handling only by the ear loops and not by the actual mask itself. It's so important. And you really want to make sure you do this. And if you have cloth masks, you have to wash them thoroughly. And it's definitely recommended that you dry them because heat actually kills the virus. So it's so important that you do this. Another area, the North Carolina Department of Health and Human Services has really done some great guidance lately on the different types of risk. So we know we have some risk takers out here. So they give you a spectrum: lower risk of activities during the holidays, moderate risk, and high risk activities. And we certainly want you to do this, but I do want to remind you, here in the state of North Carolina, under the executive order, you're supposed to limit your gatherings to no more than 10 individuals. And so if we follow that, we'll do much better in reference to during the holidays. And I think this is something that we need to do until we have been able to deal with community spread to reduce that. Here's some information that I think is important to share in reference to COVID-19. This is something that I have on my kitchen refrigerator in reference to the information, getting text updates, and making sure that we have access to all the information that is needed so that people are aware of what's going on. Here's some information as far as other websites that give you all the information. I know it's already been shared about the free testing, but that's available to everybody here. But please get yourself tested on a regular basis if you possibly can, especially if you're out in the workplace and you're engaging with the public. It is important that you get yourself tested. And then also some other information from the Food and Drug Administration on food safety. I now want to take up just a couple of minutes to share with you one of our health and safety alerts as far as for those in the workplace. We've developed this fact sheet to really give you all the information that you really need to know about protecting yourself in the workplace. All of this information is on the website that I had shared with you for worker training. And it really gives you just the basis of all the information you need. And if you can, print it out, put it in your workplace, let people know what's going on and about the resources that are available to you. And here's specific information about workplace health and safety for COVID so that you can get additional information if you're looking at a specific workplace, because of course there are higher rates of exposure if you're in healthcare, if you're in construction, or you're in places where you're in close proximity to individuals. And so the material that's been developed on a lot of these websites really shares with you specific details on how to develop an infection control plan for where you work. Now I'm going to close out. I just wanted to share a couple of pieces of information. One of the things that we're seeing happening right now is that there are a lot of disasters happening. And so what we're trying to do at NIEHS and working in collaboration with the Federal Interagency Working Group on Environmental Justice to have some town hall meetings that are coming up, that we're partnering, trying to understand what's happening in our community around hurricanes, major floods, wildfires, and developing and sharing resources, and then also training. So in addition to the work that we're doing, we're going to be offering disaster response training for individuals to share with them about what's going on. And here are the town hall meetings that we have scheduled for January, February, and March. And then we're going to coalesce this information and try to develop tools and resources to help the community. Lastly, I was a part of a work group with NIEHS and the American Industrial Hygiene Association to develop guidance to protect volunteers from COVID-19 during natural disasters and response. So that information is now available on our website and also on the AIHA website on their Back to Work Safely page. And so I put the link here, but this is designed to provide natural disaster response, unpaid volunteers information, how to protect themselves from SARS that causes COVID-19. So it's really important, especially because we know we want to help out our neighbors, but we have to make sure that we keep ourselves safe in the process. And we know that we're still having hurricanes. We still have hurricane season, one of the largest hurricane seasons and the most intense that we've had in a long time. So we really have to look at, and same thing with the wildfires that are going on out on the West Coast. So we thought this was an important tool to develop with clear guidance on how to protect yourself if you're responding. And so that concludes my presentation, and thank you for listening.
Thank you so much for that, Ms. Sharon. I appreciate it. And, you know, I'm going to use, because, you know, I like props, okay? I like props. I got my mask. I'm holding it by the loop. Look, see, I'm going to bend it from my nose. I'm putting it on. And look, y'all can still hear me. See, I got a thumbs up. But, you know, I'm that type of girl. I like to coordinate. Do y'all like to coordinate? Who like to coordinate? Y'all being so quiet. Look,
I know.
I'm going to coordinate with it, right? Right? Hey, right? Absolutely. I'm going to coordinate, okay? Okay, I see you, Ivan. Yes, it's all about that mask life. And look, I got some hand sanitizer. I keep these things with me everywhere I go, right? Gonna put some hand sanitizer on my hands. I got 2 of the 3 steps done, right? And we got to stay at least 6 feet away from each other, but we just know Dr. Thompson, she dropped knowledge. It could be farther than 6 feet, right? Oh my gosh, I got to go and get me a yardstick. I'm going to get me a couple of them so people are not too close, right? But I said all that jokingly but seriously to say it's so important to carry your mask with you. And you can have it and you can personalize it for what you like to do as well. But definitely make sure that you wear your mask, because we know that this is one of the most effective ways, as our presenters have shared, to prevent the spread of coronavirus-19 as well as contracting coronavirus-19. And so now we're going to take a few moments to answer some questions. I'm going to pass the baton over to Mrs. Tony Arnold McFarland to share some of the questions that have been shared by everyone.
So Kirsten, I know that we have some students that joined us tonight. They're students from various youth groups, and I invited them because I wanted them to have the opportunity to talk and get their questions answered, because some of them want to return to their build spaces and workspaces. So if there are any students on, let me just kind of check those questions. The first one says, or here's one, should youth groups who meet outside of school attempt to return to their meeting spaces? What should they consider, and how can they get regular testing if desired?
Yeah. Well, I guess, so I'll go ahead and answer that.
Yeah, yes.
Okay, great. I think what is most important to realize is that if you're youth groups and you're meeting outside of school, you still need to follow those guidelines, wearing a mask, still, you know, making sure that you're at least 6 feet away, and doing everything you're supposed to do. But you want to make sure that you're doing it in a safe manner. And I tell folks is that students, whether they're in school or not, you still have to have stay that safe distance and wear your mask and wash your hands on a regular basis. And you should consider getting testing. Yes, if you're engaging and if you know you're in, outside of your household and you're with other people, there are opportunities, but you should, of course, speak with your parents and talk to them about the best way to go about this. There are free testing sites available throughout Durham and Wake and all throughout North Carolina that you can utilize. I know I sent several of my friends and family members to St. Joseph's this past weekend where they had free testing there. And I think this weekend they're going to also have free testing at Russell's Pharmacy in downtown Durham. So there are opportunities, and I know Marissa shared where you can get testing here also in the area. So I would encourage you to do that.
Okay, and this is kind of similar. It says, I'm a part of a local robotics team. I was wondering if COVID-19 tests would be a good option for our team before in-person meetings restart. So based on what you're saying, yes, they should get testing and take one of the options that you just mentioned. It says also, what would that process look like? What steps would we take to limit our team's interaction with anyone else being tested? So the question is, they want to go get testing, but it sounds like there's a concern about possibly being exposed to people who are positive at the test site. So is there a way they can limit interaction with potentially COVID positive individuals when they go to the testing?
Well, I don't know if Marissa wants to talk about it, but I can definitely say that the testing that I have been engaged with, they're all protected. They are in a high level of PPE. Some of those individuals have N95s for healthcare professionals because they're interacting with the public, but they have gowns on, they have face shields. So they're definitely adequately protected. And so I'm not so much worried about those individuals who are doing the testing. You should be more worried about community spread and what's happening in your community. And right now, and I'm just gonna say personally, I would not be interacting if you're going to be within 6 feet of anybody right now because there's too much community spread. And so I encourage folks to just stay within your household as much as possible because you really don't want to actually get that close to individuals because asymptomatic exposure is happening on a regular basis. And so it's so important for us to really just wait and try to wait out until we get a vaccine before we start going and being in close proximity to individuals before we do any of these types of things. And like I say, just essential activities is what you need to be going out and doing. And that's the most important thing. And that's the advice that I would give everyone right now.
So what I'm hearing you say that it's not a good idea for the youth groups to be meeting right now unless they can do it virtually.
Absolutely.
Is that what I'm hearing?
That's
okay.
What I would strongly recommend.
Okay. All right. I'm going to see if Doug or Elliot see any questions on Facebook Live. I know we're on several. We're are live on LinkedIn. We're live on several Facebook groups, pages. Do you guys have any questions in the chat? I'll let them look at theirs as well.
No questions from Facebook. The only question somebody already answered.
Okay. All right, I'm just kind of going through. We had probably about 3 different students here. All right, I believe you've already answered this one. Basically, you would tell them no, this isn't a good time to try to meet. And I have a question just for my own understanding. So I heard, I want to say, Dr. Johnson Thompson talked about, you know, the vaccine and her confidence in the vaccine. Now, I'm going to be honest. There are a lot of people who are not feeling very comfortable about getting the vaccine and making sure that it is going to be effective, and who was it tested on, like those kind of questions have come up. How can we feel more confident in the vaccine? What would the testing process be like? How do I know that it was tested for me, you know, Black women my age? Or how can we understand what the outcome could be if there is an issue with the test? I always like to take the worst case scenario. So what are your thoughts on that? Any of you?
Yeah.
And I'll start with
So
Dr. Johnson Thompson.
I'd like to speak on that. So yes, and we know that there are problems with trust within the community. But at the same time, I have seen a number of cases. They've done a lot of advertisement on Black folks who have actually participated. The other thing is that in New Orleans, the president of Dillard University and the president of Xavier University actually enrolled in a trial, and they encouraged their students to enroll. And that's true information, let me say that. So that was their way of their contribution in terms of getting the Black community to see that others like them are you know, doing the vaccine. So that's one way.
Okay, and we did also have some members of the Latino community on as well. I think they had to drop out, but I'm pretty sure they're wondering the same thing.
Right.
Are they included in that test group?
That was one of the, and let me say this too, and in particular because I worked at the NIEHS, but the NIH as a whole, and I chaired the Institutional Review Board at NIEHS for I think about 10 or 12 years. And so there are rules wherein when NIH funds a study, you have to have a diverse population. And each year, you know, you give your report, and if it shows that you don't have that, then the trials are shut down.
Okay.
And one of the things I can also say is that your minority serving professional associations, particularly the National Medical Association, some of their auxiliaries, are really taking a high degree of scrutiny on the vaccine, because they want to come out and say, you know, this is safe, because we know how important it's going to be for our communities. As I said earlier, you know, we're disproportionately represented in those frontline essential workers, those people that are more vulnerable, coming into it with chronic conditions that put them at greater risk. So, you know, given the high degree of, you know, politicization of the process, that has come with heightened scrutiny. I think that heightened scrutiny will help to assure folks that, you know, the process has not been short-circuited, or no corners have been cut in the development.
Okay.
And
All right.
I'd like to add from the local level, so a lot of the vaccine distribution is going to fall to local health departments, and I just want to let the group know that Durham County, I'm sure across North Carolina for local health department level, have already started planning. We are aware of the mistrust and issues with vaccine development, because it's been faster than anything that's been done before.
Right,
so there's
it really
safety
is.
questions. And so we have that in mind. We're reaching out to community partners and also community members, particularly communities, Black and Brown communities as well, keeping that in mind, because those are really communities, and I'm sure people already know this, that have really been harmed in the past. And so, you know, how do we, you know, address that, and also get the message across that this is a safe vaccine and the benefits of it as well. And so we're in the planning process.
All right, and I did get another question from a student. I know we talked about going into the back into their space. Let me see if I can find that. But while I look for that, another one just popped in. It says, oh, here it is. In the worst case scenario that extracurricular groups do meet, and an outbreak occurs, what would the next steps be?
So whoever wants to jump in, I'm just thinking about from the local health department level. So I'm assuming if there's an outbreak, somebody in that group is going to get tested. So when there's a positive test, as mentioned earlier, they'll get a call from the local health department for where they reside. And it's extremely important that they answer the questions and also give information for contacts, because those contacts will be contacted if we're not already aware. And then, of course, isolation too. If you've been exposed, then you'll get a message to quarantine. And if you are showing symptoms, you have at least 10 days from when you start to show symptoms. But getting tested, sharing your contacts, staying home is directed by local health departments. And those are the main things. And getting tested. And I dropped some sites for free testing from the state, and also if you're in Durham County as well, to find those.
Yeah.
And what is it? Oh, go ahead.
One other thing that I think is so important, and we've been talking about this, isolation and quarantine. If you think you're exposed and you're staying at home, that means you still want to be isolated from your family at home until you know for sure that you do not have the virus, because you don't want to spread it to your family. So that's one of the things that says, if you have a basement area, you have another area where you can stay. I know you don't want to do it, but if you're possibly exposed, you got your test and they're telling you to isolate, you still need to isolate from the family and individuals in your household, because you do not want to spread the virus if you do come down with it. And then looking at that critical period, literally from 5 to 10 days, to make sure you have no symptoms, but still waiting the full 10 days at least, because you could still be asymptomatic if later on, depending on when you're exposed. So you really have to look at all those things. And what is most important is that you really talk to your healthcare providers, your public health folks. They can walk you through all of these steps so you know exactly what to do and how to stay safe. And if you do by chance start to feel bad, you have to get medical assistance immediately. That's what's happening in so many of our communities, is that people feel, oh, well, I'm not really that sick, but COVID impacts you so fast that if you don't get to the hospital quickly or get to some public health care, then it can really knock you out quickly. And so we want to make sure that you get access to health care as soon as possible if you feel like you don't feel yourself and something's going on.
Okay, and it also probably would help to go ahead and have a thermometer, a pulse oximeter, before. I just kind of have that. Just go ahead and get those items and have them at your house. Now, please define the difference between isolation and quarantine. I want to make sure people understand what the difference is between isolation and quarantine.
Marion, do you want to cover that?
I was going to ask, the only thing that I would say is specifically, they mean the same. They really mean the same. But the issue that I really wanted to follow up with what Sharon said was that, it's good if you have a basement. It's good if you're in a 3-bedroom house. It's good, but what about if you have 1 bedroom and you have a lot of people there?
Or 1 bathroom.
Or 1 bathroom. And
or sharing the bathrooms.
I wanted to ask Mrs. Mortarboy, is there anything any resources available to people who have the disease? I mean, they have it, but they don't have sufficient
a place to isolate.
Yeah. I'm reminded that in China, when they got rid of it, they would put people in hotels. They made up these isolation areas. Yeah.
Yes, I know Durham County, for those experiencing homelessness, there are plans for people who test positive. I know there hotels have been used in the past. I know there's also a duplex. So if someone does test positive, they don't have anywhere to go, then there are places in Durham County.
And how would people find out about those places if they're sharing, kitchens and bathrooms? How can they find out about a place to go if they cannot safely do that at home once they've been identified as positive?
So I'll look for the information to drop it. I know when our contact tracers call people, if they share their needs, for example, like if they have food needs or other needs, the health department does connect them to resources. And I know the housing resources, people who who are homeless. And so I think the guidance is to isolate if you're sick and other members of your household aren't, to isolate as best as you can, so as much as possible. But those resources are really for people who don't have anywhere to go. But I will, I'll look on the website and drop a link in the chat.
And also, FEMA is covering non-congregate housing for the COVID emergency. And in 72 of North Carolina's 100 counties, we've got some degree of non-congregate sheltering. And so your local emergency management can help identify where those locations are as well, working with the health department.
So we need to get that information out, because I didn't even know that. I mean, I knew that it would be important, but how do we get that information out? Make sure it's in the community. And also the other thing about the contact tracing is a lot of people are concerned about privacy. And this is private. And not only is it private, this is something that always has gone on with, you know, with sexually transmitted diseases. So it's not new.
Right.
And so people need to understand that as well.
Okay. All right. We are going to run short on time, but I am going to get a couple of questions, and I want to do some quick announcements. And if some people have to go, I want to make sure to get these announced. Can you guys stay for like 10 more minutes if it's okay? All right. Quick question from Facebook. How possible is it for the country to shut back down again, since cases have surged over, is it 11 million? Is that right? Is that the right number? Okay. How likely are we to have a national shutdown? It seems to have worked for other countries. Any thoughts from anyone?
It's hard to tell. It's really hard to tell. Other countries, well, some of the other countries have done it because they have a different system.
System of government, yeah.
Easy. Though I understand, did France shut down? I know they bent the curve.
No, I don't think they
bent the curve yesterday.
Yeah.
Mm-hmm. They did do targeted shutdowns.
Okay.
Certain facilities. But I think from just in general, one of the most important things for us to do right now is wearing a mask. If we can get everybody here in the United States to wear a mask and limit the contact from people outside of their households, and make sure that they're getting follow-ups in reference to if they feel sick or those type of things, do the normal stay the course type of things. And that's the most important thing right now, because there are communities right now where they've eradicated it because they actually wore the mask. They
followed the instructions.
Yes, did the instructions. And so that's where we have to get back to. Now, there will be targeted shutdowns, because when you have community spread like you're having in South Dakota and Wisconsin, where their positivity rate is 20 and 36%, you really do have to stop people from going out except for essential services, because that's the only way to stop the community spread. So I'm sure that there are groups that are working on this right now to really address how we're going to implement this. But until we get a vaccine, we're going to be wearing masks for quite a long time.
Okay. And just to kind of bring up something else, because some people don't realize this, that if you do get it, there's still effects that you may continue to deal with for a long time. I have several friends who have it and who had it, but they're still having to be on a respirator at night, or they have not fully recovered, and it's been months. And then also, if you get sick with anything else, it doesn't have to be from COVID-19. If you have to go to the hospital, you may not get the care you need because the hospital system can be maxed out. It can be burdened by the fact that there's so many people there. I mean, that's happened in my family. People have passed. Even my father went to the hospital for something that was not life-threatening, but as a result of the fact that there were so many people there with COVID-19, just not having enough resources made it the quality of care not as good as it needed to have been. Okay, here's a question about the mask. K95 masks, N95 masks seem to be more available than they were at the beginning of the pandemic. What's the guidance from the panel on the use of these masks for the general public? 3-ply cloth masks for essential activities. What are your thoughts on using those masks for the general public?
Well, I'll tell you from an industrial hygiene and a health and safety perspective, N95s and KN95s need to be held for healthcare professionals. Because one, in order for you to wear it and wear it safely and wear it properly, you have to have a fit test. You have to make sure that it's the right size for you and it fits. And so this is what and there's still a shortage. There's truly a shortage of N95s. And right now, what we're using is the N95. Those are NIOSH approved. The KN95s are Korean, and they're approved through, not Korean, but from China, based on their standards. But there are so many counterfeit KN95s on the market right now. You have no idea whether you're getting a real one or not. And so if you feel like that is making you safe, it might not be safe at all, because if it's not made correctly and it's not molded and using the right process, it will not protect you if you're around someone who has COVID. So that's why they're recommending the 2 to 3 ply mask for the general public. And I'll tell you now is that if you're an EMS, firefighter, someone who's in close proximity in healthcare, they need to have those masks for their use right now. And so that's where that's what I would recommend that people do. Now, if you are in a case where you have someone who is COVID positive in your household and you have an N95, absolutely wear it, because that's your only way to protect yourself. But we would prefer to have the isolation and all the things in place to stop that from occurring.
Okay. All right. How can someone determine if they were previously infected with COVID-19?
You can get the antibody test.
Antibody test, okay.
And in fact, LabCo, they will do both of them. You know, I've gone there and they're fast. You get the results back the next day. LabCo.
Okay.
And also, if you do blood donation, they'll do antibody tests as well.
Okay. Okay. All right. Also, let me see, what was the other question here? UV lights, are those effective?
They are not effective for individuals. Over a long period of time, they will sterilize the environment. But UV lights are damaging to the eyes and in some concentrations to the skin. So you don't want to use that. Don't want to be under it. And if you think about it, UV lights are used in hospitals, but they're used at the end of the day when no one's there.
So there's some products out there like UV lights, like a wand that you can wand over surfaces. Do you have confidence in those? Are those too dangerous?
I think the ones I've seen, it's really for inanimate objects. It's not for doing it on yourself.
Okay. But you're okay with that? You guys feel that's appropriate for inanimate objects?
It's not, no, not really, because the spectrum is not that high.
Okay.
Yeah. So, you know, I think that's just the.
Got it. All right. Do we have any more questions coming in from Facebook? Okay. Someone said, what can I do to keep my classroom safe? This is a school teacher.
Well, I can address a couple of things that I think that we've been working with the teachers associations and providing them with guidance, and we do have tools and resources on protocols and infection control plans for the school. So whatever the school has been recommending as far as if you are in classrooms, follow those guidelines, but there are specific separate things to really take into consideration for teachers. And I think this is so important. If you are a teacher and you have a comorbidity, you should not be in the classroom. This is just my personal opinion because of the fact that you can't protect yourself. And so it's important that you really focus on trying to do virtual training. Let other people who are in the classroom who don't have comorbidities or don't live with individuals who have comorbidities or have any other types of immune deficiencies so that you don't spread. So you want to really think about it, because it's a personal decision whether you're going to work or not, because I know people are dealing with this on a regular basis. But whatever the protocol is for the school system, you have to follow that first. But then you also have professional associations like the American Teachers Association that really focus on how you can deal with different types of classroom environments. And one of the things that I did not talk about earlier, the biggest contributor, I think, for COVID spread is ventilation, or poor ventilation. And that's one of the things that I should have talked about for the engineers that are on the call, is that we have to increase ventilation in our household. So everybody, especially now being locked up and it's getting colder, you really do need to still increase ventilation. You need to open up your windows. You need to let air exchange happen in your homes, most definitely, and do it on at least a weekly basis. That's what I recommend to all of my friends, to make sure you have air exchange in your homes, and to do that. But a lot of places, restaurants, pubs, those places have very poor air exchange rates. And if they don't have proper ventilation, that's why we're seeing a lot of the outbreaks in those type of facilities. And for me, I recommend do not eat inside of a restaurant. Any place where you have to remove your mask, that's not the thing to do when we have wide community spread. Still patronize them if you want to. Go in there, be safe, do all the steps, take your food home, eat outside. That I think is the best thing to do from a personal perspective, to make sure that you're safe. You're on mute.
How effective are air purifiers?
They're very, very good, I think, very effective. If you can't open your windows, you know, air, because they have filters in them too, remember.
Right.
So they're very good.
Yeah. And the other thing too is that just making sure that you're changing your filters in your home on a regular basis. You're doing the checks of your home to make sure you don't have mold, you don't have wetness, all the things to make sure that you're safe inside your home. Healthy homes are important right now. So you need to follow all those steps to make sure that you're safe in the homes. And NIEHS did a webinar this past week on healthy homes and how to make sure that you're doing the right things when you're social distancing at home. And so I can share some information also on the tools and resources that were made available to the public on that particular webinar.
You know, one other thing that I'd just like to mention, because in the scientific community, this is really known. I don't think it's really been spread a lot to the community. And that is the focus that the virus is airborne. And so there was a New York Times article today that said COVID-19 is airborne indoors. Why are we still scrubbing surfaces? Okay. So I take that back to what Sharon continues to say. The most important thing is to wear that mask. Yes, you want to sanitize your hands, but you really don't need, I mean, I know people who've scrubbed down vegetables without Clorox, and that's, you know, there's no evidence that food carries the virus, and very little evidence that the virus is on surfaces. And even when there is a virus on a surface, keep in mind that infectivity is determined by the number of viruses in a closed space. So if you're in a small room and there's no ventilation and somebody is infected, your chances are really great. But on the opposite, just as we've said, if you're outside that same person and the wind is blowing, the chances are eliminated or decreased.
Awesome. Well, I'm going to go ahead and wrap up. I do know that we are beyond our time. Let me see, I think I do have one more question. Do we need to wear a mask when you go outside for a walk, jog in your neighborhood? So people are being outside, and I've seen people saying, "Oh, it's safe outside, so I don't need to wear my mask because I'm outside."
No,
I'm jogging.
You do not need for someone who is huffing and puffing to pass you. But what you can do is what I do. When I see somebody running towards me or even walking, I go on the other side of the street.
Awesome. All right, we're going to wrap up. Are there any final comments?
I would say it never hurts to wear a mask. We need to
Well, that's
just get
true.
used to it.
That's true.
Okay,
You know, the more we do that, we can get
better
to
off
this
we'll be.
vaccine. Sooner we can get back to, you know, a regular way of life.
Right. Well, and do you have any concerns about the accessibility of the vaccine once it's available? Do you think that there will be some communities that will probably not have access to it as well as others? And what would be the plan for that?
We're making sure that, in particular, those communities where there's a high concentration of people that are essential workers will have access to those vaccines. And people that, you know, again, have 2 or more chronic conditions, they're high on the list as well. So we're really trying to make sure that the people that have been impacted the hardest by this virus, you know, have an opportunity to get the vaccine, you know, earliest. We're working with federally qualified health centers, with free and charitable clinics on being vaccination distribution sites, so that people that don't have health insurance, low income,
Right.
you know, there's not a barrier for them to get the vaccine.
Exactly. Awesome. Well, I am going to go ahead and get us ready to wrap up. I would like to say that if we were in person, we would present each of you with a certificate for coming out tonight and sharing this valuable knowledge to Research Triangle professionals of NSBE. We're not able to do that, but we will make sure you each get a copy of a certificate that will look similar to this. And we do appreciate you taking time out tonight to enhance our knowledge and make sure that we are ready for a safe holiday season. Thank you so much. I do have a few announcements I want to share real quick here. And as I bring those up, Kirsten, is there anything you want to mention as we wrap up?
No, Tony, I'd be remiss if I did not take the opportunity to thank you all once again for sharing your knowledge in this space in which you operate in every day and really bringing it to the community. While we are on a Zoom, Facebook Live type platform, the great thing about us being on the Facebook Live platform is that we have the opportunity to have this conversation, go and reach others. And so thank you again. Words cannot express how much we appreciate your expertise, not just here in this format, but you're doing in the community for all of us. So thank you for everything that you're doing for us.
Awesome. I'm going to share some quick announcements, and as I do so, I'm going to ask Carla if she's still on. Carla is our professional development chair, and we have a number of special interest groups. And I just wanted to know if she has anything she wants to mention as well, as because we also touched on some health innovation topics, and it also enhanced us professionally as well. If you're on, Carla, you can get yourself ready to share any thoughts or final remarks. I don't know that she is. If she is there, could someone just please let her know? As she, if she is and gets ready to say something, I'm going to go ahead and go to these next few slides. So our pre-college initiative and our collegiate initiative, here's a couple announcements. We did launch Research Triangle Collegiates. Basically, this is an opportunity for area colleges to get involved with NSBE. If they don't have a chapter, that's okay. You can go to our website, rtpnsbe.org, and learn more about Research Triangle Collegiates. Basically, you can join as a member at large. The member at large rate is $15 for the year. And students, it will give you an opportunity to apply for scholarships, also attend our conferences, be able to potentially get an internship or permanent position through the NSBE resources. Also, there is a free STEM Success Summit that started today. You can still register for that. Information is available at stemsuccesssummit.com, and this is for students. I want to say it was high school and college students. Also, a new scholarship is available. This information is on our website. John Deere is going to provide 2 scholarships of $1,000 each. The application is open now until January the 3rd. So college students, please go to our website to get the eligibility for applying. We also have a fundraiser going on. This was our 2020-2021 year, but we are still celebrating the fact that we are the professional chapter of the year for 2019-2020. We do have shirts available. If you're interested in getting one, this is also a fundraiser for us. These are only $12 plus shipping, and we will have a pickup option for that. If you don't want to pay a shipping fee, just go to our website to get more information. Go to rtpnspe.org and then go to the membership link at the top, and you'll see a place where you can purchase your shirt online while supplies last. And we do have a professional development seminar coming up that's going to focus on process improvement, special interest group, the transportation SIG, and also the information technology SIG. And this is actually open to the public. It's free. If you are considering certifications and want to understand how these can help you advance your career, you don't want to miss this. We'll talk about Agile, Scrum, Six Sigma, AWS, Cisco, SaaS certifications. I might be missing some, professional engineer. If you're interested in learning more about that, we'll have a roundtable format discussion with individuals who've already been down that journey, and they may be able to share some insight with you. And that's all we have. I'm going to say happy Thanksgiving to you all. And as we have heard tonight, be safe. Make sure that you follow what you've learned tonight. We'll make this information available to you. We'll put it on our website. The event page is going to stay up. We often go back and add additional information to that page. So if you are on the call tonight and you did not actually register and you would like to get this emailed to you, please go register tonight, and we'll send out an email update that has information from the chat and information from our panelists that was shared tonight. And if there's nothing else, if I missed anything in the chat, I'm going to ask Doug or Elliot if you see any other information in the chat that we need to share before we close out tonight.
Let's see, nothing else I see. No, nothing else I see. There's several resources and links in the chat if you want to just check that out.
Okay. Did I see something in there from Arthur Edge? He's our national director for the Healthcare Innovation SIG. I thought I saw something from him. He had to leave.
I'm looking through everything now. I don't see it right now. It's just an introduction.
Okay. He just says, reach out to healthcaresig@nsbe.org if you're interested in working on following up with further projects on COVID-19. So in regards to healthcare disparity. So that may be something, panelists, that we might come back to you about. Again, thank you all for coming. Have a wonderful evening and be safe. Have a blessed one.
Thank you.
Bye-bye.